welcome to the Health Enthusiast Podcast. Here we explore groundbreaking research and innovations shaping the futures of science and health. And today we have got an exceptional guest. He's a distinguished microbiologist and lecturer at Base University, Abuja. Dr. Paul Isaac Ojodale holds a PhD in microbiology from the prestigious Ahmadu Bello University, Zaria, specializing in medical microbiology and parasitology. His research focuses on emerging zoonotic diseases, neglected tropical diseases, and the critical roles of hand hygiene in preventing infectious diseases. He is also the head of microbiology department at Base University, Abuja, where he oversees postgraduate and undergraduate research work. In this conversation, we shall be discussing challenges and futures of microbiology in Nigeria and beyond, the insight he has gotten from his research, and then the experiences he has gathered, mentoring postgraduate students. So, Dr. Paul Ojodale, you are welcome to this program.
Thank you very much.
All right, so to set the ball rolling, what really sparked your interest in microbiology, and how did you finally pitch your tent with medical microbiology?
Thank you so much. Right from my childhood, I've always been fascinated with things that produce results, innovations, and then like to be adventurous. So the point came normally as young people, I want to read medicine, I want to read this. But as you begin to grow and begin to go further, you begin to see that there are various aspects of the healthcare profession, science, research, and technology, and that which you can pitch your tent with. So over time, initially I was saying, medicine and the rest, okay, but when I now saw that the sea is wide, I had to pitch my tent with microbiology. I had a good JAM score. And then our names at the Ahmadu Bello University, they used to publish it in the newspaper. Then a name was given, and then microbiology, and I had to pitch my tent, and I've not even deviated to any other field or try to change my course. And microbiology actually has been fascinating to me. Dwelling with working on microorganisms, seeing that the unseen world controls the seen world. So looking at the unseen to see that it has impact on the seen. I believe as the discussion continues, we'll share some of my findings with you. But this is basically what propelled me into the field of microbiology.
All right. So, as the head of the microbiology department at Base University, Abuja, what are some of the challenges and responsibilities that come with this role?
Yes, it's a challenging role. I know Base University is an innovative university, a center of excellence, believing that we are to be the best in all that we do, and we leverage on technology to carry out our work. Is it the delivery of lectures, research, and innovation using state-of-the-art equipment and the rest of them. Now, but there's also the administrative role leading such a program in the university. We have undergraduate students and the postgraduate students. And the postgraduate students, we have the PGD, the masters, and the PhD students all in that department. So it's a whole lot guiding staff and guiding students into seeing that we attain excellence. So there's a whole lot that comes with it. Make sure you deliver, you carry out your community responsibilities, community service, and also to carry out your research and your academic work, the whole lot.
All right. Guiding postgraduate students can be highly demanding. I speak in this tone because I think I have tutored a couple of them. What are those challenges you face in mentoring postgraduate students, and how do you ensure that they stay focused, they stay on track with their research?
Yes. Yes, you just took it off from me. This is a powerful one and powerful question. Yes, because postgraduate students, we see sometimes we have students probably after their undergraduate years, they will go into the industry or go and do one or two things, and then after sometimes want to come back. Now, some of them have lost touch with the current reality of where the course is right now. So we have mentorship of the innovation, the research. So we have to go all around to make sure that we bring them up to speed to where they need to be. Now, also have issue of postgraduate students trying to combine the postgraduate work and probably their work they also do to be able to like that. So at much as we can, we try to make them to know that, look, you have a purpose. There is a target, and that target is that you'll be able to churn out meaningful research at the end of your program. You work with your supervisors, you work with your other staff and your students to see that you're able to achieve. We have what we call a normal seminar that we do, where we make our students to talk about current realities, things, to make presentations of current innovation, current discoveries in the area of microbiology. And that has put our students on their toes. They tend to listen. They have to be current on the news, social media, to see anything that has to be new. And then you bring it. You work with your supervisors. You make a presentation to the department, and everybody gets to see the newness about it. And then we always let our students know, especially our PG students, that look, you are like the master of what you are presenting. Be confident. Confidence is one thing that we have enshrined in our students, to believe that they hold on to that, and then you'll be able to talk, be able to express yourself. What you don't know, you don't know, but what you know, you'll be able to express it, and that has really helped us to be able to guide them. So our PGD students, master students, PhD students, they're in the top of their games, and very soon we'll begin to graduate them and begin to see some of what they have been doing.
Quite interesting. So, with the increasing report of zoonotic diseases outbreak, what do you think should be the critical steps in preventing and controlling these diseases in Nigeria and in Africa as a whole?
Yes, thank you so much. This is a good one, and it has also been a challenge. And this has brought to fore the issue of the One Health concept that is being talked about in so many quarters right now, where we talk about the role of man, the role of animals, the role of plants, and the role of the environment in the spread, prevention, and control of diseases. Now, zoonotic diseases are diseases that are transferred from animal to man, or reverse zoonosis, that from man to animal in some cases. Now, and this is prevalent, and we are seeing this every time. So it calls for a concerted effort of all stakeholders, not only those the vets, not only the microbiologists, not only those in the healthcare. Everyone must bring their hands on deck, because zoonotic diseases cut across, cuts across, and we need to sit down to see like that. We have a lot of vectors here and there carrying the causative organisms, and finding opportunity to be able to see that they pass. And sometimes this has led to epidemic diseases, and that has affected a whole lot. So all of us must come together and play our role. So the government has a role, the research agencies have a role, the ministries, departments, and agencies, they all have a role. And then the One Health concept, we must, as much as we have, be able to stress it more, so that everyone in the value chain will play their part to see that diseases are curtailed or even eradicated.
That's fine. So, what are some of the key barriers in eradicating neglected tropical diseases, and how can research bridge this gap?
Yes,
How can research bridge the gap?
Yes, thank you so much. Yes, we know that, just like from the name, neglected tropical diseases, there are about 20 of them officially listed as neglected tropical disease entities by the WHO. And sometimes these are diseases that are not so much talked about. One, either because of the stigmatization that come with it. Take leprosy, for example, and then the other ones. So the stigmatization that come with it, and the rest of them. Also, we also see funding is a challenge. Funding is a challenge. If the adequate funding is given, this will help. And then we also see the issue of the healthcare. This is sometimes, just like we say, neglected. The attention of the health sector on some of these diseases is not adequate. It's not as much as it is expected. And these are also causing the kind of diseases, schizophreniasis, your onchocerciasis, and this. If you check, the high rate of the mortality and morbidity is high. It's on the high side. And especially, we in the tropics, we must take the ball is in our court. We must take this fight from here. In those in the tropics and subtropics, we must take this fight from here. And government also always waiting for funding or from the outside. What are we doing in our own sector here? We in this area, how much is being devoted as part of the budget to neglected tropical diseases? The research that has been churned out, how much of it have been related to the society through various means? Good, we are doing what we are doing right now, which is part of creating awareness that even though they are neglected, that has not stopped the morbidity and the mortality of these diseases.
That's interesting. Hand washing practices have always taken a back seat. We only become conscious of it in an emergency situation. What innovative strategy do you think can improve public adherence to proper hand hygiene practices, especially in a resource limited settings?
Yes, this is good. uh, this is good. Dr. Itodo, this is great because hand washing, as basic as it is one of the most effective ways to prevent diseases, to also boost confidence. When I know that I probably just saw you wash your hand, there's that level of confidence I have to be able to relate with you, to know that this person is like that. So it boosts confidence, and it's one way, most effective ways, especially at critical juncture of the day. Before you eat, after you eat, after using the toilet, you need to wash your hands. When after coughing, sneezing, you need to wash your hands, and the rest of them. There are certain microorganisms that are being carried in our hands. Microorganisms are ubiquitous. Now they are carried in our hands, and these hands, before you know it, consciously, subconsciously, you would have touched one part of your body, you would have put your hand somewhere, and the rest of them. But if you wash your hands consistently, constantly, from time to time, it boosts your confidence. And what does it take? In limited resource areas, sometimes you can improvise. We have taught young people to improvise, to use these plastic bottles in terms of reduce, reuse, and recycle, to control the environment. Those plastic bottles that we throw away, we just turn them, punch the top, put water, and then you can form your own tap, and you can wash your hands even in resource limited areas. And then the 7 steps for proper hand washing. I think we should create the awareness on all social media platforms, where you apply water to your hand, apply soap, then you rub your hands together as step 1. Then step 2, the back of your hand. Step 3, in between your fingers like this. Step 4, now you cup your hands. Step 5, around the thumb, you do this. Then step 6, in between your palms, so that even your fingernails, that the soap will get to that place. Step 7 on the wrist, and then you rinse your hand. Now, once you do that from time to time, you are sure that your hand is clean, and you can go about your day being confident that diseases, microorganisms, and bacteria will be kept at bay.
That's interesting. With your good track record in trichinosis, can you share with us your findings and maybe understanding of this disease, and how can government respond by increasing surveillance, improving awareness or creating awareness, and then implementing some key policies in food safety measures to curb the spread of this disease, essentially?
Yeah, this is another good question, and a great one, because trichinosis is a reimagined zoonosis. Sometimes, people have thought that, okay, probably nobody is talking about it again, and what is the pathogenesis, what is the impact of this disease on the environment. But it's one of the most expensive diseases that so much have been spent in the USA, in China, and some of the European nations because of this disease. Now, we know that the organisms, Trichinella spiralis, and the other species, Trichinella, the other species that make up this genus, they are there in the environment. And from pork or improperly cooked meat, you have this. This is what is there. And we have many parts of even our country, Nigeria, where people eat pork. And if it is not well cooked, and in fact other meat sources too, if it's not well cooked, then you stand at risk of transmitting this parasite. Now, this nematode can, immediately it gets into the stomach, and it releases the eggs, the male and female mate, and they release the eggs. The next thing, they get into circulation. And one of the things my work was, because the larval form normally before the diagnosis of this parasite, you wait until it encysts. It gets to where it encysts, probably it stays, and then begin to form some bombs, and then begin to do biopsy and the rest of them. By that time, the parenteral, the enteral part, you pass there and then it is settled. But what if we can track this parasite, the larval form, in the blood? And that's what my research focused on. And we were able to see that once we detect the gene, the ATP6 gene, that of this parasite, which is shed in the blood system, drugs will be administered, which are available even before they get to the place where they get encysted. So, but what we need awareness. We need more funding in this research. No matter how you do it, if you don't have funding, you will not be able to. And then to use state of the art. Before now, the compressorium, the microscopy, the pepsin digestion method, and that has been used. Now we are using PCR now to get as much as possible to sequence, and then to look at the phylogenetic diversity of this parasite even in our environment. So this goes a long way. So awareness, we need to create awareness. We need more people to go into this research of trichinellosis and other re-emerging zoonotic diseases, which will eventually help us.
Where do you see microbiology heading in Nigeria and globally? What emerging trends or technologies do you believe will shape the future of the field?
Is good, and because microbiology is evolving, great to have the multidisciplinary research now, which we've been talked about in different places. No, microbiology, some people, when they just hear microbiology, the first thing is just microorganisms. I know small. Somebody who say microbiology is small biology because of micro. Now, but it's far more than that, because yes, microorganisms, but they can affect the macro. So it's very, very important. So we see the unseen. Now there are various aspects of this microbiology. We have the medical microbiology, parasitology, we have environmental microbiology, industrial microbiology, food microbiology, and various aspects of this microorganism. What can you talk about without talking about microorganisms? Which areas of our life will microorganisms not impact? So in the next few years, what we are seeing now is with the expansion of research and innovation, and then seeing that microorganisms can be used to even clear oil spills, So we are already looking at bioremediation, and various aspects that these microorganisms will now be used, protein growth and the rest of them, contact tracing, and a number of things that these microorganisms will now be used for. So with the innovations going on right now to sequence various bacteria, to look at the whole genome of bacteria, I believe that with time, also full professionalization of the course, especially in Nigeria, will go a long way. There's a political angle to it, and there's the diplomatic angle to it, and every part will work together, and then to see that microbiology too will work together with people from other fields, so that we'll be able to achieve our results. We've worked with sociologists, yes, when we looked at something, we've worked with psychologists, we've worked with this, so that we'll bring them in this period, and work with medical lab scientists, doctors, medical doctors, and the rest of the pharmacists will work. Pharmaceutical microbiology is there, veterinary microbiology will work together to see that we're able to achieve the results that we need.
Effective research requires collaborations. What area of microbiology research do you think require the most collaboration? And how can Nigerian researchers connect with their international counterparts?
Yes, beautiful. And incidentally, that's what we have been canvassing right now, and then we are already doing it. We have to work together. You and I have published a paper before, and then this thing like that, we'll sit down and look at things and then put ourselves together to be able to do that. Now, all aspects of microbiology needs to be their quality control. Yes, industrial microbiology, medical microbiology, environmental microbiology, we need to work together. Things are environmental impact assessment, climate change, so that we'll be able to meet the SDG goals and the rest of them. Now, what we need to look at is, what is this person bringing to this research? What is this person bringing to this research? We have seen some people who even Europeans who are interested in some of the species of microorganisms that we have in this area. You need to do some comparison. There are some, yes, members of the genus, but there are those that are endemic to this our particular region and the rest of them. And what makes them that? Understanding the genome, understanding the genetics of this the microorganism is going to help us a lot. So we need to build up that confidence among ourselves, bring ourselves together and look at it. And okay, we've had statisticians brought into some of our research, so we need to do that. So we need to open up. Today we have webinars now that people from different parts of the world can attend. Good and fine. We have okay, through technology right now, you can be here and hold a conference that thousands of scientists and researchers from different places can attend. You know, a whole lot is going on, and we need to encourage that right now. Also, our research too needs to the entrepreneurship, the marketing of our research needs to go. Most of the time, you just finish research, you just dump it on the shelf. No, we need to market it. We need to take it far. You know, during COVID, we learned a lot of it, a lot of things. You know, the mRNA vaccines and the rest of them came up as a result of what? Okay, and today, companies, pharmaceutical companies, have bought into these things and these ideas and are using it. So we need to work right now. All hands must be on deck. Everybody must wake up, and the microbiologists must also take the lead, must be in the vanguard.
What advice will you give to a young microbiologist who is considering a career in research, academia, and public health?
Yeah, wonderful. What I would say is that, come on, the sky is wide. The environment is there's a large room for you. Come in, don't be discouraged. Sometimes it takes a whole lot before even your research you can have a breakthrough in research, but you continue. But you know what? Sometimes we think about our economy, okay, get rich quick syndrome. I want to hit it now. I just want to finish, get a job in an oil and gas company, hit this, and then before you know it, and now, but who will now do the research? Who will now do the research? We have fake and substandard drugs everywhere. Who are the people that will let our people know that these drugs are not good? They are actually agent of death instead of agent of life. Who are the people that will do it? So we have like that. Public health is there. We need to epidemiology. We need to get into this fields to be able to see that we help ourselves, encourage ourselves into doing it. So welcome on board, and all aspects, every other discipline, we need to work together to see that we come to the point where we make our nation the best and the greatest that it needs to be. Most of the nations that have advanced today, science and technology is at the root of their advancement. They spend so much today, even in the military, every aspect, biowarfare and the rest of them, you must take interest because microbiologists needed in these areas. So we believe that we'll be able to work together to do it and we'll be able to achieve it.
So thank you very much, Dr. Paul, for sharing your thoughts with us today. It's been an absolute delight to have you on this show. Thank you for coming.
Thank you so much.
So to wrap it up, if you enjoyed this program, don't forget to subscribe. Just subscribe and then give us a thumbs up. And we may equally need your feedback to know where we can improve upon. So until next time, stay curious and stay healthy as usual. Thank you.